Hello, my name is Dave Kohan and I'm currently a first-year exercise physiology doctoral student at Kent State University. Our study was an examination of the effects of the COVID-19 pandemic on physical activity in Division II collegiate athletes and was conducted at the Indiana University of Pennsylvania during the spring 2021 semester. It was derived from my master's thesis, The Effects of the COVID-19 Pandemic on the Physical Activity, Mood, and Motivation Levels in Division II collegiate athletes. The COVID-19 pandemic has disrupted the training and sports participation of college athletes, but to what extent regarding Division II collegiate athletes is currently unknown. So we hypothesize that the COVID-19 pandemic has affected the physical activity patterns in Division II collegiate athletes. Therefore, the purpose of the present study is to determine if the COVID-19 pandemic has had an effect on Division II collegiate athletes' physical activity patterns. While we had a total of 40 survey responses, 3 people were excluded from the results due to not completing the survey in full because they put NA for the open-ended question. The athletes were specifically from lacrosse, cross-country, track and field, football, and volleyball teams. A total of 8 of the survey questions were about the athletes' physical activity habits. The survey took less than 10 minutes to complete and was distributed via student-athletes' emails twice a week for 4 weeks with a link to the Qualtrics survey sent from the PI's email. All physical activity questions pertain to the last 3 months on the survey, which was given in April 2020. They could respond to the questions with either a Likert scale or yes or no, depending on the question. Then the question was coded with a number. For example, regarding the last 3 months, do you typically train outside your team's program? Yes would be coded with a 1 and no with a 2. So if the mean was 1.56 as the response, then the general consensus was that the athletes typically did not train outside of their team's program, since the mean was closer to 2 than 1. The open-ended responses were grouped by common themes and put in order of how many responses fit into that category. The open-ended question was how training and physical activity has changed resulting from the COVID-19 pandemic for the athletes. Here's the 8 physical activity questions to take a look at with their mean and standard deviation results and responses, as well as qualitative design and the themes for the most common questions, as well as the amount of subjects that responded under that theme. The participants on average gained about 4 pounds of unplanned body weight within the past 3 months before the survey was administered. The average athlete did not participate in training outside of the team's program within the same 3-month period. Participants reported typically training with 9 teammates on average, and they typically train in well-equipped facilities when possible. When participants were asked the open-ended question about training and physical activity has changed resulting from the COVID-19 pandemic, the majority of participants responded with either new roles or generally have been the same. New roles included social distancing during training, masks, cleaning, and less consistent gym time due to COVID rules. In conclusion, the pandemic forced athletes to modify training times due to gym availability and access from the new and ever-changing restrictions that were implemented at the time of the study. These roles led student athletes to train in uncomfortable environments, mainly due to wearing a mask while training and having to limit the number of training partners they could train with. Despite all of this, the population Division II athletes surveyed reported strict adherence to team programs. It is important to note that while these athletes adhered to the program, they still did not participate in physical activity outside of the program for the team, and therefore are most likely doing less than they were in the last season when they weren't as restricted by closures and rules affecting exercise facilities. Future research should examine long-term effects of these types of training restrictions related to sports performance and physical activity. Future research should also include follow-up studies to the addition of physical activity and mental health intervention to see the best way to improve these athletes' health after the pandemic from the weight gain as well as the lack of physical activity participation outside of their team sport. A limitation to acknowledge in the study is the sample size, with only 37 total N, with a possible total N of about 400. There could have been more survey responses, which would have allowed for these results of the study to be more generalizable than they are with the smaller sample size. Thank you.